Not Upendo, Milwaukee. That means I love you. Welcome to the Nyumba Upendo show with Kweku and
Dr.Alisia, Moutry, and we do love you, Milwaukee.
hey, we do it. You know what? We couldn't do it without my man Jermaine right out.
Man,
Byron.
appreciate it. Yes,
Come
sir.
on.
Yes,
And
sir.
tell them who else
Yes.
we got here. DJ Clark.
We got the one and only DJ Clark Kent. You
Hey,
understand?
come
me?
on. That's how we
Let's
bring
go.
it to you. You know, that's what we do on Nyumba Upendo. But you know, we can't start the show until we do our P&Ps.
Oh yeah, and you know what? I got a chance to talk with Mom. She always does a prayer for the audience, and so she wants to know about the people that are coming, and so she prayed for both of you to be able to impart whatever's on your heart, the knowledge that the community may be able to benefit from. And then Milwaukee, she also prayed for you, just some peace. She wanted peace in the world, and then our engineers. She always remembers our engineers because she know the show can't happen without the
Come on.
engineers. So,
That's what
Mama,
we
we
do.
thank you.
Yeah, and as in the tradition of the elders, it is required that we get permission. She is given that permission. And then the spirit of the show, we always dedicate the show to an ancestor. And so I thought it was fitting this time because July 16th is a day, a lot of birthdays and whatnot. So we just celebrated my Uncle Kaliwali's 80th birthday.
80 years old.
Yeah, it's special. And then
Yeah.
one of my sister's best friend who became my sister, Kim Eubanks.
Baby
we call
Bird,
her Baby
is,
Bird.
Baby
It's her
Bird is what they
birthday.
call it. Happy
And
birthday,
then
Kim.
one of my best bros, Mr. Marcel Clark.
That's right.
His birthday today. And so we think about these birthdays and it's there. But I do the juxtaposition with a funeral I just went to of 20-year-old Nate White.
Yes.
And another one of my fraternity brother's son, football player out South Dakota, went to Wisconsin. And it's like you see the juxtaposition. So you know how precious life is. You know, we talk about celebrating birthdays because you just never know when your birthday might be your last one. So we want to celebrate and give flowers. But while I was doing it was so weird because I was like, well, who do I want to dedicate the show to? And it was Ida B. Wells, and her birthday is July 16th. But when I thought about Ida B. Wells, I was like, you know, she was a journalist, you know, she was a communicator, but she was also a sociologist and she did a lot of studies. And in her studies, she wanted to let people know what was the data so they can be informed by data to be able to make different decisions. So she was real big with anti-lynching. She was big with women voting, women's suffrage, getting women to be able to go out, not only to be able to vote, but to be able to hold offices. And in addition to that, I was just like, what more can she do? She was one of the co-founders of the NAACP. So when we think about organizations that was built to be able to help the community, to be able to help those who are most vulnerable, I was like, how important is that? And when I think about today's show, I was like, man, this is exactly what the spirit of this show is today. When I think about like different organizations that come in to help, we always think about the places that come and the places that really benefit the community. And we got a chance to sit in for a heartbeat this past Friday, Dr. Moutry. Mm-hmm. And in that show, we had a lot of the board members from Outreach, and they were talking about all of the things that they were doing in the community. And they was like, well, we couldn't do it without certain partners. And one name that they kept mentioning was the Medical College of Wisconsin.
Yes.
And I was just like, that warmed my heart because I love to see when we get these big anchor institutions directly connected with our institutions within the city that really hit again those vulnerable populations, and it was there. And so when I think about this show, I like to thank my guests for their patience. They were supposed to come in back in April, and then my sister tore Achilles.
Oh
and
right. Not me. Don't put that on me.
and,
Knock on wood. The devil is a lie. Not me. No, sir.
But they were so patient and said, you know what, we understand. We'll just get another time. And we worked and we worked and we worked, and we got a time. And so now, you know, I don't know.
But everything is about timing.
It is.
Really? I mean, maybe it wasn't supposed to be then, but it's now.
It is. And so when I think about who we have here today, you know, it's like I'm going to do an introduction. Usually Alicia kind of brings everybody in to let them do that. I like to bring people credentials. And I do the credentials first because I think that's just the tip of the iceberg. That's to say, you know what, people have credentials. They have the validity to say, hey, I'm qualified to do what I do. But that's just the top of it. And when we get beneath that iceberg, that's where Dr. Moutry comes in and get to the heart. So people, you start to understand, not only do I have the credentials, but I got the heart and I got the why, and that brings the desire and the love in what we do. So first I want to talk to her about Sister Jennifer Harris. I want to call her doctor because all of the great stuff she do. So maybe that was another prophecy and whatnot. But what I love about her is whenever I see anybody who can do a lot of different intersections, you see them in the academy, working in the academy. Then you see them working in government, whether it be local or national, or then you see them working like in institutional government institutions. And I remember I had the privilege to do some speeches for the SDC, and I remember seeing Jennifer in the audience and coming. But it was like that was their conference. They used to talk about being poverty warriors, and they was like, we want to destroy poverty. We want to make sure anybody who's dealing with this know that you have an army of people who love you, an army of people who care for you and want to do certain things. And when I saw that, I was like, that's a part of the organization that I love to be a part of. Now, we all know in the community some of the things that happen with SDC, but we also know a lot of the great things that they brought. And one of the things that I think that I was most impressed with Jennifer is she was behind the team that, remember when Milwaukee County at first said, hey, we got an epidemic here. And it's in the area of racism. Usually you think epidemic, you think, like COVID, some other things. But when you think about that team, and that really put Milwaukee on the map, because people was like, yeah, this is an epidemic. We need to do something about that. We need to look at these social determinants of every aspect of life that's causing things. And I know Jennifer mostly from being a member of Alpha Kappa Alpha Sorority Incorporated, Epsilon Kappa Omega chapter. And she also does work with Jack and Jill. Them chapters is necessary with of America Incorporated. So welcome to the show, Jennifer.
Thank you for that beautiful introduction. Oh, goodness.
No, well, this is the thing. Like I said, at least you're gonna bring out the heart. I'm just giving the titles and the stats and everything like that. And so now, who I want to do is this is a lady that you hear about names and things of the nature you see across, but just recently got a chance to work on some kind of advisory committees where you get to see people like really in action. I was like, oh, I like her. I was like, I think she's serious about what she's saying, because I tell you, I work with a lot of people and I'm pretty frank. If I think somebody fake, I'd be like, yeah, I can't work with them because I don't think they're hearting in the right place, and I don't want to be a part of a show or anything like that. But when I think people are really invested, it's there. So when I look at our doctor, she said just call it Dr. T, but when I look at Dr. Terry DEROON CASSINI, I look at all of her accolades, and Dr. Moutry, I'm nervous to even read this out when you say it. I don't know how she do all of this. So listen, she's the professor in the Department of Surgery. She's over the Division of Trauma and Acute Care at Medical College of Wisconsin. She's the director of the Comprehensive Injury Center, the medical director of the Trauma and Health Psychology at Freighter Hospital. And Freighter Hospital is a level 1 trauma center. So if you know anything about those levels, that's like when something serious happened, you got to be top notch for that. And one of the things when I used to work with the old Office of Violence and Prevention, we used to work with 414 for Life. Yeah. And that was one of those entities that people didn't really know how to handle, because you had all of these people with lived experiences that turned it around and want to do something great for the community, but it would always be odds with certain things. And I remember it looked like they might be going down for a minute. And then Reggie Moore was there. And then when he went over to the medical college, was able to do something. And I see you one of the co-directors of 414 Life. Yeah. And if people don't know what 414 Life is, these are the individuals who are in our community, and they come in as interrupters. They come in as the people sometimes where even the police can't go to be able to diffuse situations. And I look at them sometimes as like a fire alarm. Fire alarm don't get enough credit. When the fire come and the firefighters come and put it out, they're like, oh, look at what they did. But sometimes those fire alarms put out fires before they even come. And so it's like sometimes the unsung heroes or don't get enough credit for some of the things they do. So when I look at all of this, I'm just like, my goodness, do you have time to sleep?
I sleep sometimes.
Yeah, so we're going to talk about self-care today. We're going to make sure that the helpers are able
there you go.
to help. But Dr. Moutry, I know you always like to bring in
you know what? Because sometimes you hear all of that and you go, is this a real person? And I like to, before even starting into all of the business, I just want to know a little bit about, like, where are you from? Like, where were you born and raised? And then maybe you can tell the listening audience a little bit about maybe the roles or the hats that you actually wear on a personal level. We're talking to the community. We want them to know that you're reachable, that you're touchable, that you understand, just real life. So let's go ahead. Let's start with Dr. T, and then we'll go to Jennifer.
Yeah. So I actually was born and raised in Huntington Beach, California.
Oh, okay.
And then I went to Marquette University for my master's and my PhD.
I'm like, how? Why?
I met my husband here. He's from Wisconsin. We stayed. I love it here. So I've been here for quite a while. And I will say I wasn't sure what I wanted to do when I went to college. I wasn't sure what I wanted to do. I had a lot of interest in science, and my undergrad's in zoology and physiology. But I became an AmeriCorps scholar my senior year in college. And I was able to, I had the amazing opportunity to work in a domestic violence shelter, providing direct victim services to women and children who were really violently abused by their partners. And that was life-changing for me. I experienced, I saw firsthand what it meant to have PTSD, what it meant to have depression. And so I took 2 years off, actually taught at Custer High School, which is now Obama. You didn't know.
Coosa Indians, Coosa Cougars.
They used to call me Mrs. D, but that was before I got married. And I taught 2 years
I know
there.
you got some heart now.
Community, you know we bring to
teaching at Custer. It was, but I also knew that even though I loved teaching, it was the students that I loved connecting with them and hearing their stories. And both of those experiences really led me into wanting to become a health psychologist and trauma psychologist.
Absolutely. See, that's the kind of stuff we want the community to know
There's
about and
the
hear.
heart.
It just perks up an ear. I'm going to tell
say
you.
Custer, man. You got a whole bunch of
That's
things.
just a little street. They got a little street cred up in here, Dr. T. I'm just letting you know. Just letting you know. Okay, well, thank you so much for sharing that. That was a really interesting, journey. That's what I want the community to hear.
Yeah.
So, Jennifer, give us a little taste of you.
So I am a native Milwaukeean,
Okay.
born and raised, educated here. I went to Carroll College first, then Carroll University for the second degree. But really the heart and soul of me is waymaking. And finding resources for other people and bringing those resources, because you don't do it just because somebody will bring it back to you. It just happens. It's supposed to happen. We're supposed to take care of our community. And so Milwaukee, I almost left. I did almost leave.
Did you really?
A lot of our talent usually leave because you think see kind of greener pastures other places sometimes.
But this guy I met was like, hey, you might want to stay here for a little bit. We got work to do here. And so this is 7 years later and a whole 6-year-old. I'm still here in Milwaukee doing the work that I know I need to do.
I'm kind of selfishly glad that happened now.
Right.
But my origin story really is in the biosciences. My parents influenced me. One's a chemist, one's a biologist. And I knew science was the way to fix the world. And research is so important. And then I got to college and I was like, I don't really want to do this. I don't want to chase a eternal why. And then I was like, wait, I'm really good at teaching people. So I'm helping people that were failing get to passing their classes. And I was like, wait, there's something there, but I don't know what. So it took me a while to realize what my true passion was helping people get resources to improve their lives and to improve and get to their passion. And so doing that, I decided to go into higher education. Against everybody saying, don't do that, don't do that. I went to higher education and my career trajectory took me to every type of school except for HBCU and Ivy. But my mentees went there, so we're good.
Got it covered a little bit.
I really loved seeing the space that research created, the innovation that transpired, but I saw the huge chasm between the academic world and the community. And then taking those transferable skills into local government, I saw the huge chasm between academia and local government. And these are the people making the decisions. And so, as you mentioned, I worked to operationalize the Declaration of Racism as a public health crisis. Say that 3 times fast.
Yeah, I know. That's why I didn't say it once.
But it put down legs, and kudos to Lillian Payne, UW Population Health, and Matt for starting that work. But again, Milwaukee was the first in the nation, the first municipality to lift that. And to make it a part of the DNA of the county, even to the county's logo, it's all the way in the DNA of the county. I'm very proud of that work, but that was the beginning. And that's how I kind of wound up at the Social Development Commission, lifting the Institute on Poverty and Systemic Racism, because this research needs to be done. It needs to be done to create evidence so we can move resources to those that need the resources and beyond. So that's
so let me ask you this, because me and Dr. T was just kind of talking about it a little bit offline. You listen to sometimes the callers that come in, they say, we're sick of research. We always hear research. We know what the problem is. Let's fix it. What do you say to them as far as like why we need to do continual research to keep it fresh?
I mean, the evidence needs to be there. The evidence needs to be there so we can build upon it, and then we can actually create the intervention, so we can create policy, so we can inform those that are making decisions. If not, well, then it's just, well, we know we're hurt in this corner, but we may not know why. We need to create the body of evidence, and not just to create it, to hold it. We got this huge repository of information. No, use it. It's our purpose to use it.
And if I can add to that too, I think, for good reason, people are skeptical about engaging in research. For a long time, research was unethical. It took advantage of vulnerable populations. And, Jennifer and I have known each other for a bit now and have worked together for a while. And, it was really important to our research team to make sure that we were building trust within the community. And we also asked for feedback. Would you do this again? Would you do this if we added these kinds of things to the research? What didn't you like to do related to the research? And I think that building trust is so important because, as Jennifer said, it's the evidence that's going to help us figure out the interventions.
No, and what I love about it is because I think this is the heart of it. You read something like Harriet Washington, Medical Apartheid, and you say, this is not just something that happened for a decade. This was something that was just systemic and from a historical standpoint. So you say, how do we get that trust? I love the fact that you have a Reggie Moore, that you have a Jennifer, some links to the community to also say here. And then also when you talk about your background, say, I wasn't born here, but I was in the trenches here. I was over up on Sherman and Villard, and people automatically understand. But now the question becomes, because of, and I know you can't get into the weeds with politics so much, but with the changing landscape of the times with politicians and things of that nature, how do you still continue to do the research? Because let's say you have something going and you're like, okay, we know what to do, but then there's barriers and barricades, and then people say, oh, we got this information, still nothing's done.
That's a good question. That's the question that we ponder every day. But the reality is the disparities are the disparities. If we get caught up on words, in which wording and semantics are very important, but if we get caught up in the words, we can't stop there. We have to dig right into what the disparities are. So call a spade a spade. If we can't say XYZ, all right, call out that exact disparity, what it is. You can't mitigate and go around that. We have the number one reason why children die is because of a bullet. You can't go around that. And so you have to call a spade, take the rest of the wording away, and work at the true root problem.
And I would say too, we've worked really hard to develop a research program that's engaged with the community, that's around what is most needed for those that are most vulnerable. And we're not going to stop that. And so if we need to change the way that we talk about it, fine. But the reality, to Jennifer's point, is the data are the data. For example, cardiac health is significantly worse in the Black and African American community than in the white community. That is clear. And we have data to also support that. And so we're not going to shy away from saying that because we know we're backed by data.
I love that.
And I would add in there too, it's not just because something impacts one subset. COVID let us know that we're all so inextricably interconnected. It actually impacts everyone, and people don't understand that. And that's where our building of evidence can help bridge the gap. Like, hey, no, this impacts you too.
So I guess when I look at that, like I hear Milwaukee County. So I sit on the Milwaukee County Mental Health Board, and I say, this is just almost impossible because it's 19 municipalities. So when I look at what's going on in Milwaukee versus what's going on in Greendale, Greenfield, Fox Point, River Hills, like you just got this gambit from Bayside to Brown Deer. And I'm thinking about you as one of the flagship campuses of all of Wisconsin. I look at UW-Madison and I look at Medical College of Wisconsin as being like the people who have to do everything for everybody. So you talk about intertwine. How are you able to get data from an area like in the outskirts of Wisconsin towards Milwaukee and be able to bring those together so everybody can see if we help one, it helps all?
What is it? The 52 counties of the 72 counties in Wisconsin that the CIC itself has impacted. And so we are.
So you said CIC, you got that.
Thank you for the reminder. The Comprehensive Injury Center, in which Terry is the director and I serve as the associate director. The deputy director. Ooh, don't tell Mike I said that.
I won't tell him. Hopefully he's in the emergency room working.
The deputy director, and the work doesn't, even though we know their lines on the map, again, we're all connected. And so it may place causes and some origins that we all need to pay attention to.
And just for myself and for the listening audience, can you just draw me a map again of all of you, like named a lot of different organizations? So we're talking about the Medical College of Wisconsin. And then how does that, just real quick, how does that connect to you, the what you described as far as your office?
Yeah, so we are the Comprehensive Injury Center. So as Jennifer mentioned, I direct the center. She's the deputy director, and Reggie's one of our division directors, Reggie Moore. And the Comprehensive Injury Center is a center within the Medical College of Wisconsin, and the goal is to prevent injury not just where we are here, but across the state of Wisconsin. And then because I'm a faculty member, I sit in a department, and so I'm in the Department of Surgery, in trauma and acute care surgery, and then we as providers serve the trauma center at Prager Hospital. If that's not confusing enough.
No, that helps.
We got to go to a break and we're going to straighten it out on the other side. We're going to let y'all drive the conversation when we get there. That's a little fun.
Like that.
But listen, you're listening to Nyumba Upendo on WNOE 860 AM 106.5 FM. We'll see you on the other side. Hey, welcome back to the Nyumba House of Love on WNOV 860 AM 106.5 FM. If you're just not joining us, we are engaged in a great conversation, Dr. Moutry and myself, with Jennifer Harris and Dr. Terry DEROON CASSINI from the Medical College of Wisconsin. And we're just talking about really like how does these institutions that's in the state really help our community. And the one thing that really brought us to talk about like coming on was a big thing that you're doing, and this with the acronym of DRIVE, and it stands for Dismantling Racism, Invigorating Equity. And I know you do this as a big research study, and it's so many things we can go with this, but I want you to give us the nuts and bolts of this right away. So somebody listening, when they hear DRIVE, what should they think?
So I will say this is my previous, I'm wearing another hat. So previous to this current role that I am with the medical college, I was in the community space in the Social Development Commission and tasked with lifting the research arm of the commission. And our seminal research project was the DRIVE study, in which I'm going to give further reference that this is a whole different time and space, and funding was different at that point in time. But since this funding has concluded, but the DRIVE study really was a true partnership between Marquette, UW-Milwaukee, and the Medical College and the Social Development Commission. And I say that, and I say it proudly, because at the Social Development Commission, we were true partners in research. I've been a part of research where you're
name only.
Yeah, pretty much. The discussions about budget had an other room behind you. You don't know what's going on. But truly, we're at the table the entire time from beginning to end, and really put the community at the center portion of this study, being cognizant of this is some heavy work. This is heavy lifting. So supporting people while they are engaged in the study.
Right. Why, as an educator, I'm so used to so many acronyms. There's an acronym for everything. So you talk about the DRIVE study. I know that stands for something. I'd love for you to talk about what it stands for, and then how did the name birth?
Yeah. Well, I would say at the core of the research that we do is something called the socio-ecological model. And what that really exemplifies is this, that we cannot consider the health of an individual out of the context in which they live and their lived experience. And when we think about that, we cannot consider the health of a person outside of their relationships, out of the neighborhood that they're living in. And further, we cannot consider the health of an individual without taking into consideration the policies that affect them as individuals and the broader structural factors that influence their health. And so this study was really about, how do we understand uniquely in Milwaukee, what are the most influential factors affecting the health of individuals living in poverty?
So I was looking at the original study, had 400 people, and it was coming out the zip codes of 53209, 53218, 53216, 53210, and 53206. So when we start to look at that and some of the other, like when we talk about social determinants specifically within the African-American community, we always see the studies as far as being one of the worst places to grow up as an African-American. What was some of the things that you got? We talk about some of the hardships that we had. What were some of the resilient features that you saw in those communities that allowed you to build off of it and do something positive with the study?
So I'd say one of the resilient, and I actually want to give a note that we actually were supposed to recruit 200. Actually, this is a part of the resilience. We were supposed to recruit 200 individuals to participate in the study. The criteria was that you identify as African American, you're 18 or older, and that you spoke English. And there's a hesitance, and the rightfully so, the reluctance to participate in research. So we were given 2 years to recruit 200 participants. In 6 months, we had 200 participants. Now, if that's not resilience, if that's not understanding and coming into purpose, yes. So, huge kudos to our team that did the recruitment, Star Jess and Kaylin, who were frontline and did the tabling and did a lot of the work.
But let me pause right there, because I think some of it is because you're talking about it's the SDC.
Yes.
So also that's 17th. That's Jake's, the juice kitchen. I know where this area is at. So when somebody comes, I do have a different level of trust. So when you talk about that and you kind of fast forwarded and moving, you have these partners, but now you're really in MCW. How do you keep that same lifeblood with your recruitment and sustaining that?
I think what it was is truly, again, we had the community at the core of what we designed, the anonymity, the protection, and the well-being of the individuals that participated in the study. So we had on-call counseling available, and I couldn't be over there. I couldn't watch all the things, but I know that there was somebody that had needed assistance, and they got that assistance immediately. Like, we knew that what we were asking people to think about could be not supposed to say the word triggering, could be trauma, could bring up trauma inducing. Yes. And so just having the full support of the team, from security, leadership, staff, really protecting people as they were in a vulnerable state, it was deeply appreciated.
So when I do research, one of the things I do is I get my goal, you know, and then I say, okay, what is the object? What do I want? What's the results I want? And then I try to reverse engineer it. So thinking about the DRIVE study, what was the original hope to be able to get, and what are some of the things that you're doing and in the process of doing?
Yeah, I think we were really interested in understanding what are the factors that can be influenced that are affecting the health of individuals in Milwaukee, particularly individuals in Milwaukee who are experiencing poverty. And we know that poverty is not non-random, right? So by that, I mean, we know there's policies and structural factors that go back decades for why we have clustered poverty.
Stop, Dr. T. It's kind of like you're talking about critical race theory. I know that doesn't work, but so you can't say that. But as you go on,
well, I think it's important to acknowledge, right? And so part of the first aim of our study was to understand what are those structural factors that are influencing health of individuals in Milwaukee. And probably not surprising is that the clustering of the disease that was being experienced and the clustering of the health issues clustered in the same way and overlaid other maps we have about socioeconomic deprivation, which then overlaid the maps that we have about redlining from the 1930s. So we still see the effects of that today. And for that reason, it's important for us to not ignore that policies have dramatic impact for decades, almost a century, on the health of individuals. And so if we are going to think about improving the health of individuals, it's not just making sure to give someone an opportunity to have their blood pressure taken and making a referral to a primary care physician. It is also lifting up these data to say, okay, what policies need to change still today to reverse things?
So when I was looking at some of the studies, I saw like the average income was around like 23,000. So when you look at that, so sometimes even if you're at the poverty line or just below it or above it, it still has a lot of different ramifications. So when you think about working on a study like that, it's certain things that's just not within your factor to control.
Right.
So when you're dealing with that, what is the mindset to say to the people that you're working with? Because I know you said we have some counseling on the side. What are some of the things in mind where you, for yourselves, because I can see how that can be frustrating as a researcher, that you say, listen, let's stay within our box, what we can do. We can't fix everything. How do you keep that mindset of saying, this is what we can control, and those other things, how do you deal with seeing it and like feeling, I don't want to say defenseless, but sometimes that's how you feel, because you say, I would love to do A, B, and C, but we're only equipped to do D.
Yeah,
I think it's the understanding, the grounding that, yes, we can't fix everything all at once, but once you look at a system and you begin to break a system apart and you start to engineer the piece that you can, and then you build upon and expand upon, and you bring in more resources and you connect the dots. Like our study, hopefully somebody takes our study and they build upon it. And so it's, yes, we are defenseless in some frames of thought, but we are powerful in taking this information and empowering people that are already empowered, but giving them more insight into what can help their lives be better and what they need to. I don't like when people say, just go vote. No, you need to advocate all year round. You need to really change what's not working in your life. And this is kind of creating that evidence of, yes, this exactly is what's not working in my life.
So this study has me so intrigued. I got like a question that has like 3 prongs to it. So I'm going to try to break it down as easy as possible. One, I'm just curious. We talked about the 200 participants that you were able to actually get within 6 months, which is absolutely amazing. I would love for you to tell the listening audience a couple of things. One, can you describe just in a high level view of the demographics of those 200 people? Can you talk a little bit about maybe some of the findings? Like what did you find out, and then maybe some of the challenges that you had?
Sure.
So I'm visual spatial. So I'm actually looking at the MilwaukeeTrauma.com website, and under research, there is a listing of white papers as well as some of the infographics for the DRIVE research study. So we were very excited because being at the Social Development Commission, you saw droves of women coming in, just droves of women. And to know that we had just almost an equal response of men that came in and participated in the study, that made my heart feel a certain type of way, because it requires the whole family and the whole community to learn forward and to make change. And so 57% of our participants identified as female. There was a criteria for them to identify as African American, but we know some things happen when you do a survey. So 95% identified as African American. What was super interesting, I saw, was that 70% of the participants were single, had never been married. I was like, wow. Well, maybe we need to do a little matchmaking.
So that's the pool.
Because
they talk about marriage can help with the male health. I have heard that before. Male health.
They live longer for some reason, because maybe we end up taking care of them a little bit. But I would say the high school education, I believe it was around 77%. So these are individuals that have had the time and space to learn, to take in the occurrences of their life, and really think about how systemic racism and how discrimination have impacted their lives.
And the range, we had an age range, a pretty broad age range. It was all adults, but we had a pretty good distribution across age, which is really important, right?
What's the youngest to the oldest, though? Just curious about.
I think our youngest,
18.
it was 18.
You had to be 18.
Yeah, you had to be 18. But we were wondering, would the younger adult population be interested in doing research with us? And they were, just as much as the older population.
I think of the second prong of Dr. Moutry's questions, like far as like what were some of the things that you really discovered, and I look at the heart of the matter. That was one of the ones that jumped out to me. And when I look at it, like this is with the 400 participants, I think it was like 85% had abnormal high blood pressure, and we talk about that being a coronary to heart disease and things of that nature. What are some of the other things that you found out about that study, and even more?
I'd say that was eye-opening, because our recruitment team came to me and they were like, hey, we think the blood pressure cuff is not working. What's going on? And we're testing and we're checking it, and it's working. We changed the batteries. We're like, do we need to buy a new one? But then we realized, no, this is the reality of individuals walking through the door, how their life has resulted in these unreal, because there were actually 6 people that weren't supposed to be walking through the door. They were at such a critical
because their levels were that high.
Waiting to happen.
And so it's just like, how do you continue forward and not share this information? And so we did we let them know we're not physicians, but we did inform them that this is where your blood pressure is. Like, we need you to go and speak to your physician. And we know that about a little more than half of the individuals that came to participate have some state insurance. So like it's a possibility. So please take care of yourself was one of the larger messages. But again, we need this evidence to show, like, this is serious. We know people are dying, but to see it walk past you, it's a whole nother story.
No, it's a high level. But what I do love is, like he said, hey, what can you do? And you were connected with the 16th Street Clinic with Milwaukee Health Services. And then I think it was a clinic on Saturdays that served the underinsured and stuff like that. So what do you want to talk about?
So the medical students at the Medical College of Wisconsin have a Saturday clinic for the uninsured. And so we were able to also provide that as a resource, because it is, as Jennifer said, so important that people get their blood pressure checked. If, this reading and research was so high, they need care. And so we were able to partner with them and let them know we're going to be sending people your way because we're seeing the results that we're seeing.
I was gonna say another one of those partners is outreach too. So I just wanted to give them a shout out.
No, I just went on and just thinking about the fact that people could walk in the door and the blood pressure be that high that you say they shouldn't have even been able to walk in the door. That just hit my heart really hard. And thinking about the listening audience today, blood pressure is nothing to play with. And what's unfortunate is that sometimes people don't even know that their blood pressure. We're functioning, we're doing all kind of things. We don't even realize that's happening. So just a reminder to our audience is what kind of came to my heart right now.
No, it's one of those things where we talk about those regular checkups and everything. So when I look at like the heart of the matter, but then like you get to some of the other things, you talk about the exposure to violence.
Yeah, it was so high. Our exposure to so we have this survey that was validated by a different research team, but we've adopted it into our research program, and it assesses individual exposure to community violence. Are you hearing gunshots in your neighborhood? Are you seeing individuals getting shot? Are you seeing individuals getting attacked? And so it assesses like 40 different questions and different ways that people can experience community violence. The rates of community violence were significant. And so when we think about health, and then one of the most significant factors that influences poor health is stress, right? Mm-hmm. And when you have individuals that can't be home and feel a sense of peace, because they're hearing gunshots,
or bullets coming literally through the house.
Right. So when this goes back to that idea of you can't take an individual and understand their health and do health interventions without considering the context in which they live. Absolutely. Right. So I'm hopeful that individuals who go from our study and go get their blood pressure checked, their physicians are having conversations with them. So tell me about what it's like to live where you live. What are the major stressors that you're experiencing? Do you feel safe? Because those things over time can cascade to significant health consequences.
So I'm just curious about a couple of more of those indicators. So exposure to community violence. So you talked a little bit about I know you said we're like 40, but I'm just for myself and the listening audience, what are maybe a couple of other things that maybe people would hear say, oh, I don't even, I've been dealing with this for so long. I don't even know that is considered community violence. Can you give just a couple of other examples?
Yeah.
I'll jump in there and put in social media. So we're so attached to our phones, and you don't even realize the morning dig and the scroll that you do. And you might take a second between something you're doing and you're digging, you're scrolling, you're taking all of that in. And so many occurrences, even though they did put the screening up to say, if you want to see this, the little eye.
You still say yes. That makes it even more.
That makes it worse. But you still take these in. These are subconscious and very conscious things that you're taking in that impact your overall mental health.
Yeah. And also seeing intimate partner violence, right? And so in the home next to you, knowing that either witnessing it directly, those are other examples of exposure to violence.
Listen, as you hear the music, that means you got to come up on another break, but we're not done. We're going to come back and we're going to make sure that you get more information about Thrive, not only about that, but what you can do to be healthy, what you can do to make sure your loved ones are in a safe position. You're listening to Nyumba Upendo on WNOV 68, 6.5 FM. Welcome back to the we are in the last segment, but we got 8 minutes to roll.
I
So
know,
we
I
gonna pack it
know.
all in. You can get a lot in. I know that you was talking about like all of the different aspects of trauma. Like you said, we really
Yeah. It's really meant to be a diagnosis that comes after someone experiences a trauma, right? One thing that really was surprising to us and important information for us to share is that the rates of PTSD in this study for the individuals who participated are at the same level as rates of PTSD for military personnel who served in war. That's right. Yeah. And that also leads us to think about, well, if they're also experiencing ongoing community violence, it's really not post-traumatic stress disorder, right? It's ongoing, sometimes referred to as continuing traumatic stress. And so this has led us to really rethink how do we do intervention from a mental health standpoint with individuals who are experiencing ongoing trauma. There's great evidence for intervention for people who are now living in a safe place, they're beyond their trauma, and yet they're experiencing PTSD, but that intervention is not okay for people who are experiencing ongoing trauma. And so we need to be really pushing forward interventions that are sensitive and specific to populations that are experiencing not just ongoing community violence, but ongoing racism and discrimination, and not just in the moment, but historically, right? That's
This is hard work. None of the researchers, none of the trainees on this study team are being funded or paid. We knew that we had to continue forward and disseminate this information. So and you know academia is published here. Yeah. And so I asked them a very blunt question a while ago. I was like, so how much time and space do researchers truly put into dissemination? They gave me a real blunt answer. So I'm glad to share with you guys that before this effort that we have to really just flag to bring people over and research study is floating out there with QR codes on that. But to know that we're presenting every day and a day in their lives, but we're here with you to ensure this information gets out. That's not part of what needs to continue to transpire. Research and evidence needs to be built, but this information has to be back out to the community and in meaningful ways that we can use to help change lives.
I would just say I would love for the listening audience put a plea out there on doing people. You talked a little bit about sometimes the people can push back on it. Why is it important? I think it's important to me because I know this evidence needs our stories need to be told, whether it's via newsletters. So that means I want the statistical side of it, but I also want the story told. Yeah, give me the story. The story telling people. Yeah, we need the both in, and we're not going to be able to start to break systems apart and get the solutions that we need unless we start to participate. You need to get your seatbelt. The seatbelt, honestly, is based off of the body of the life and health. Like, if we don't participate in research, things aren't going to change. And so I caution a little asterisk there. The attention space, be very attentive of the research and your science. You shouldn't be forced into it. If it feels wrong, it feels wrong, and you can go ahead and not participate. Consent is a real thing. And so if
feel any manner of harm, get on out and request your information back because it is your information. So, yes, participate, but make sure that you're safe, make sure you're supported. We're not only doing this for ourselves, we're doing this for the next generation so they don't have to keep talking. I always say, I do this for the love of the community, but my daughter, you better not be asking the same questions. And like, if it's coming from me, she's 3 times worse than I am. So if I'm asking, I'm doing, I'm moving, she's about to do the earth. So I don't want her to ask me the same questions when we could have worked together, brought forward resources to make our lives better.
I remember.
Uh-oh.
Profiting like what you did, what are you going to see? I love it.
We partner running before. We both have Achilles injuries. I run. I ran at 5 o'clock this morning. I run every morning. For me, it's meditative. Right? It gives me the energy for the day, no matter how much I suffer. That's just for me. Everybody is what helps. I also meditate. Just as much as running. Yeah. Just as important as it is in a positive way activate that nervous system that gets going when you exercise, it's just as important to train the other part of the nervous system that helps to make us feel restorative, right? And that's that parasympathetic nervous system. And so listening to music, rest and digest.
The calm app, the app, or title, or title. But there's a whole lot in the listen to that whole I make sure I carve out time and space for something I have to learn. Wisdom is you can't go through it. Carve out a specific space. That goes into my own mindfulness practice and being kind to yourself. Sometimes I forget, but mindfulness is it ebbs and flows and take care of yourself.
And I did work out this morning, but after this is over, I'm having lunch with a friend, and we're taking time to get together. Somebody that pours into me, and I pour into her. Dr. Kweku, what are you doing?
Well, you know what? And just be able to kind of move through some of the stuff I do. That's how I like to take it. So as you think about this, I want you to kind of think about what I kind of last to feel listening to. What would you have to say to me?
I would say your life and your experience, are it. You are now doing, you are the steward of that knowledge. So take it forward and kind of go with us, but we're taking our experience and calling out things we need to do year round so we can our living experience.
Yeah, I would say also we didn't talk a lot about resilience factor, the buffering effects and stuff, but you brought up something really important. Connecting with friends. We have data that we're investigating right now for a different study that shows that when you connect with somebody who means a lot to you, that raises certain hormones in the body that it's oxytocin, and it makes you feel good. So make sure to do the things that make you feel good, and often helps you give back to others, give to your community. It's those connections that have the strongest effect to others.
And we like to thank you for giving to the community, taking your time. You could be doing anything, anywhere, but you chose to be here today.
Thanks for having us.
You listening to WNOB.